It's estimated that 30 million children in the U.S. participate in sports.
And every year, doctors say about 3.5 million of them are taken to the ER with a sports-related injury of some sort. Now, treating these injuries can be kind of tricky in growing bodies, but fortunately, surgeons have found an approach that avoids further injury with long-lasting results. Memorial Miramar's pediatric rehab is bustling with young athletes who've had sports-related injuries.
Kids are playing sports year-round. They're on traveling teams. They're on all-star teams. They're being recruited and scouted at a very young age. And so there's demands on them. And those demands cause them to practice, play more, and get injured more.
When that injury lies near a child's growth plate, the surgery can be risky. Some doctors would even opt not to do surgery until the child is done growing, leaving the young athlete unable to play.
Nowadays, that's not really feasible. Kids want to get back on the field to play. Sports is part of their social dynamic, and taking them out of sports has led to such issues as depression, social withdrawal.
Dr. Jeremy Frank, a pediatric orthopedic, has trained in a procedure that allows doctors to repair an injury without damaging nearby growth plates.
It's a surgery that was invented more or less up at Harvard, and very few people actually practice pediatric sports medicine. The vast majority of the sports medicine doctors you see are very qualified adult sports medicine doctors, but it takes a special level of training to do the pediatric component of it and be cognizant of that growth plate.
11-year-old Zachary Smith went through the surgery after tearing a ligament in his knee.
We did a special surgery utilizing a strip of tissue on the outside of his knee called the IT band, and we wrapped that around his knee and reconstructed his ACL that way without drilling through any of his growth plates.
With good rehab, Zachary should soon be back to swimming and golfing with his friends.
He's a very active kid, and I know he's missed being able to do all of the things that he normally does. So I think that's what I'm looking forward to most.
And doctors used to think that pediatric repair was really only a temporary fix, but years of follow-up have now shown that the repair can last as long as that area is not re-injured. And don't forget to join us at 9 this morning at justnews.com for our Monday morning house call web chat. We have an endocrinologist from Imperial Point Medical Center talking about thyroid and parathyroid diseases and answering all of your questions about that. So it should be interesting.
Yeah, we saw boys in this video, but of course girls suffer injuries too.
Exactly. In fact, girls have a lot more ACL injuries and sports-related injuries than some of the boys do. Yeah. Surprisingly, a lot of the cheerleading injuries, and soccer.
Oh yeah, which is a sport, cheerleading.
It is indeed.